Hello, everybody. Welcome to our medical talk today. I have the great honor to speak today with Dr. Danny Seiler from Zurich, and we will be talking about nephrectomy. Dr. Seiler, could you maybe describe when you perform a nephrectomy, under what conditions?
Of course. Hi, Peter. Thanks for the invitation and the opportunity to talk to you. It's a pleasure. Nephrectomy normally has to be performed whether you have a tumor, a larger tumor in the kidney, or you have a kidney which is not working anymore, which is damaged and is not has no function anymore. Nephrectomy normally is tried to be avoided, since we try to preserve as much kidney function as possible. So if in case we have a huge tumor, we really have to remove the whole kidney. But in general, we try, even if with larger tumors, we try to keep the healthy part of the kidney to preserve the kidney function as much as possible.
And could you maybe get a little bit into detail just on the procedure? How is it done? How do you perform this surgery?
Mainly, I perform the surgery with the laparoscopic Vinci technology with the robot system. Since we have many advantages to use that system, we have small incisions, and inside the body, we also can move with little instruments to perform this operation. So it normally takes about, depending on the situation individually and the tumor size and the way inside of the body, everything is more or less performed. It takes about 2 to 2.5 hours to do a partial nephrectomy, meaning that we keep parts of the kidney as much as possible. If we just take off and remove completely the kidney, that's a faster procedure. Since then we have only to look for the vessels which lead to the kidney, and cut them and take off the kidney, which is a little bit a shorter procedure, which takes about an hour, I would say, with that system.
Mm-hmm. And how long is the recovery time after such a surgery?
Well, normally they stay in hospital between 3 and 5 days, and until they're really back to normal and can do whatever they could do before, I would say it takes about 2 weeks.
Okay. And would you say that the surgery, the more you can preserve, the better it is for the patient, meaning that even like complicated tumors can be somehow removed from the kidney, and let's say the affected kidney can still keep its functionality?
Exactly, that must be the aim. I mean, the first aim you ever have in an operation, in an oncological surgery, is always to get rid of the tumor. So the oncological safety is first, meaning that we definitely have to guarantee the patient that we have the tumor completely removed. But very closely to that, we try to preserve the kidney function as much as possible. And mostly it can be performed, but sometimes we have really complicated situations where the tumor is, for instance, infiltrating the vessels or something, so that we can't really guarantee the patient to have a good blood supply for the kidney anymore. So sometimes we have, even with smaller tumors, when they are in a bad position, then we sometimes have to remove the kidney. But the first aim should always be to keep the kidney, even if it's, let's say, only half of the function at the end of the day. It's still better than losing a kidney.
Dr. Seiler, thank you for the insights. Appreciate a lot sharing all this information with us. And hopefully we can talk very soon about another urological topic. Thank you very much.
It would be a pleasure for me. Thanks for having me, and goodbye.